Hello, and welcome to today's webinar, Breast Cancer-Related Chemicals in Consumer Products. I am Dr. Barbara Malkus, President of the Board of Directors for the Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. Massachusetts Breast Cancer Coalition is dedicated to preventing environmental causes of breast cancer through community education, research advocacy, and changes to public policy. I am delighted to welcome our today's presenter, Dr. Elissia Franklin. Dr. Franklin is a postdoctoral research fellow with dual appointments at Silent Spring Institute and Northeastern University's Social Science and Environmental Health Research Institute. She earned a Bachelor of Science of Chemistry at University of Illinois at Urbana-Champaign and had a PhD in analytical chemistry from Purdue University. Her research focuses on evaluating chemical exposure and justice among women based on race, education, and other demographics. Her work is helping to advance the Institute's intervention studies, exposure evaluations, and epidemiological and community-based research. Dr. Franklin also has a strong interest in research translation and using scientific training to address issues faced by Black women. One way she does this is through her podcast, The Research Her. In the show, she highlights research that is related to improving the lives of communities traditionally neglected in science communication while elevating marginalized voices in science. Dr. Franklin, welcome back, and thank you for joining us today.
Thank you so much, Dr. Malkus, for the wonderful introduction. I'll go ahead and share my screen so we can get started. And do you see the correct screen? Yes? Okay, perfect. So again, thank you for the introduction. Today's talk, I will describe the framework employed in our research on the Taking Stock study and share some of the breast cancer related chemicals that we found in products used by participants in our study, and introduce you to our work seeking to reduce breast cancer risk in Black women through product use intervention. And whenever I give a talk that frames our work in the context of breast cancer, I have to dedicate it to my foremothers who did not beat their battles with cancer. And I hope that our research helps, even if just a small amount, small bit. I hope that it helps to prevent cases of breast cancer, though we know it's hard or almost impossible to count those cases that we are able to prevent. The impact of breast cancer spans beyond the people who are diagnosed, and I want to send love to everyone in the audience who have been impacted by this devastating disease, and I am grateful to share this information with you all here today. I want to get started with prefacing this talk with some definitions that I'll use throughout the talk to describe the populations of our studies and others. So first, I'd like to acknowledge that research design, scientific reporting, and general science communication often overlook differences related to sex and gender. Sex is associated with biological attributes, and gender is a socially constructed role, behavior, and identity. So I use the term woman herein to describe the population that we study, as all of our community science participant did identify as women, and we depend on the language used in the references of the work that I describe here to identify the sex and or gender identities of those populations. And I'd also like to acknowledge that there is a lack of data breaking down subgroups of Hispanic and Latinos that have resulted in individuals of varied racial and ethnic backgrounds being considered as one category. And we know that we know that the use of the term Latina is great for describing our women, but I just wanted to acknowledge that there are some missing information about those populations of women. So, breast cancer, a little bit about the impact of breast cancer on Black women and Latinas. Breast cancer is the leading cause of cancer deaths in Black women and Latinas. And Black women and Latinas are more likely to be diagnosed at younger ages and with more aggressive disease, such as triple negative breast cancer, which have fewer targeted treatments. There are some studies that report Latinas in the U.S. having higher incidence of breast cancer than those that actually live in Latin America, likely due to the changes in lifestyle. While incident rates have historically been higher among white women, Black women have the highest breast cancer mortality rate of any racial ethnic group in the United States. And so what is important to mention is that not all breast cancer cases are due to genetics. It is believed that less than 10% of breast cancer cases are thought to actually be hereditary or from a genetic mutation passed down from biological parents. This means that other cases are related to lifestyle and environmental factors. And so there are several environmental issues that can lead to cancer disparities, including poor water and air quality, access to healthy food, and exposures to radiation and toxic chemicals. One type of chemical of health concern is endocrine disruptors. Silent Spring Institute's toxicology team focuses on mammary carcinogens and developmental toxicants, along with endocrine disrupting chemicals, or EDCs. And as for EDCs, they are synthetic or naturally occurring chemicals that can interfere with the body's endocrine system, which is responsible for producing and regulating hormones that control numerous bodily functions. EDCs can mimic, block, or interfere with hormone signals. For example, more estrogen in the body can lead to higher risk of breast cancer. So having chemicals that mimic estrogen leads to higher risk as well. EDCs are found in various everyday products, including plastics, pesticides, personal care products, and food packaging. These are products that we are not only exposed to daily, but potentially multiple times per day. Each product can then contain multiple of these chemicals of concern. So we are exposed to, we could be potentially exposed to a lot of EDCs over the course of a single day or a single hour. And consumer product chemicals are found in everyone. So these are chemicals that are not naturally synthesized in the human body that are being associated with adverse health outcomes found in our bodies as a result of products that we are exposed to. This is a point of interest for many researchers, but what our work focuses on are unequal exposures to consumer product chemicals. All people are not equally exposed to these chemicals. There are social economic factors that have been associated with differences in exposure. So Black, Latino, Hispanic, and Asian people have been found to have higher concentrations of these chemicals in their bodies than non-Hispanic white people. There are many potential routes and sources of exposure, but our focus is on exposure through the frequency of use of certain products that may contain higher levels of chemicals. So a few years back, Silent Spring conducted the first study to test the hair care products reported to be used by Black women. And the products were reported in a survey of women living in New York. And from that survey, we tested 18 hair products that were reported. That included relaxers, hair oil treatments, hot oil treatments, and hair lotions. We found 45 of 66 targeted chemicals in those 18 products. Each product contained multiple EDCs. And so what we found was anywhere between 4 to 33 EDCs per product. Some of the concentrations of these chemicals were higher in these hair care products than were found in some other products that are not used for Black hair. So we found 7 chemicals regulated in California or banned in the European Union, cosmetics, and 11 products. And we also found the highest levels of 5 of those chemicals in hair relaxers that were marketed to children. About 80 products contain parabens or phthalates, which is consistent with exposure disparities found in multiple studies and reports. And aside from hair products, our collaborator on the Taking Stock study, which I'll talk about more later, Ami Zotto and her research team reported on vaginal douching and disparities in phthalate exposure. In that analysis of the National Health and Nutrition Examination Survey, they found that Black women, in comparison to other racial ethnic groups in studies, reported higher use of intimate care products and also had higher concentrations of phthalate metabolites. So what I really want to highlight here is the lines that scientists and science communicators are drawing between product use and adverse health or health outcomes and chemical exposure. And so a lot of what we are looking to understand in our work is why certain products are used. So beauty standards for women they're unrealistic and based on spray painted people and filtered images. Beauty standard beauty standard pressures and marketing pressures us to buy products that appeal to mainstream beauty expectation. We use a theoretical framework, the environmental injustice of beauty, to speak to how social factors influence beauty product use. So this framework links systems of oppression such as racism, texturism, and colorism to racialized beauty practices, which leads to unequal chemical exposure and thus adverse health outcomes. So Black women are presented, for an example, Black women are presented with Eurocentric beauty standards starting at young ages, which leads to the use of chemical hair straighteners and use of harsh intimate care products. These are all products that have active ingredients that may be EDCs. And exposure to these chemicals and these products are associated with adverse health outcomes. Some of these outcomes impact Black women at disproportionate rates. So we need more interventions and other related work to address these disparities. In order to eliminate these disparities, we want to better understand the product use patterns for women so that we can develop informed interventions that are community informed. This will allow us to address modifiable risk behavior and create different health outcomes in a culturally aware manner. And thus was the birth of the Taking Stock study due to the lack of data documenting product use among diverse range of racial populations. The Taking Stock study was created with the goal to explore the impacts of beauty products on Black and Latina women in California. And so the Taking Stock study is a community academic collaboration led by Janet Robinson Flint at Black Women for Wellness and Bhavna Shamasunder at Occidental College, with partners at LA Group Media, Silent Spring Institute, and Columbia Mailman School of Public Health. We are funded for this project by the California Breast Cancer Research Program. And what this study does is documents the use among Black and Latinas, Black women and Latinas living in South Los Angeles in environmental justice neighborhoods. So over 90% of South LA residents self-report as a race other than white, and the area is among the top 25 most disproportionately environmentally burdened in the state. So we surveyed over 600 women of all races between ages 18 and 54 across California and gained some quantitative insights into product use and the influences of product use for the study population. We wanted to understand product use beyond that, so we wanted to get more than just quantitative data. So we also recruited 70 women to join us in focus groups to learn more about their product habits. We developed an app to record product use, including cosmetics, personal care products, household cleaning products, and collected urine samples to determine what chemicals our participants were being exposed to. And so from the survey, we presented the results of women ages 18 to 34, and we learned that women were using about 8 products per day on average, with some participants reporting as many as 30 products daily. We found that use varied significantly by race ethnicity, for 28 of those 54 products. The largest difference was between Black and white women. Black women reported a higher number of hair products and more menstrual and intimate care product use. Latinas and Asian women reported using more cosmetics than Black and white women, and we also found that 70% of women preferred scented versions of products than those that were unscented. The problem with fragrance is that it is an umbrella term that may contain dozens of undisclosed and unregulated chemicals. So that's something that we definitely want to address. For Black women, we learned a lot more about the use of product use from uh, facilitating different focus groups. And so for Black women in these focus groups, there was a lack of knowledge about hair care, which acted as a barrier to wearing their natural hair or changing their products. They spoke about reliance on family members and hairstyles, mostly for information. And they also described this pressure to feel presentable, especially in professional situations. To them, this required wearing hair products to either straighten hair or maintain natural hair in an acceptable form. So also they emphasized the use of moisturizing products to prevent looking ashy, and frequent bathing and deodorant use to smell good. Latinas also talked about their hair being tied to their identity, but were especially worried about gray hairs, texture, and hair loss. They spoke about how they were influenced by social media like YouTube and TikTok, and even older women that were not technically savvy received recommendations from social media by the people around them, like their children. Older Latinas also reported using fragrance and perfumes regardless of knowing that they have negative health impacts. However, younger participants reported steering clear of fragrance due to the chemicals that are in them. Menstruation was a taboo topic among Latinas, and most did not receive education around menstruation. They did perceive pads as being safer than tampons. Similarly, in the Black focus groups, there was a general consensus that tampons were not seen as a Black thing, or some Black women use tampons now, but very few were introduced to them by their families. They also saw heavy flows as a barrier to using menstrual cups and period underwear. The participants were aware that products that they used in childhood, like chemical relaxers, douches, and baby powder, were toxic. So they spoke about having stopped using them more recently. And so we also wanted to evaluate the chemical exposure in our community science phase of the project. And so we set our participants up with an app that could record their product use over a 7-day span. In the app, they were asked for information about each product that they used, and to take pictures of the front of the product and the ingredients list, so that we could collect the ingredients listed for each product. We asked participants to take a few surveys, so baseline surveys and follow up, so that we could understand other habits and information outside of product use. And after 7 days of reporting their products, we collected urine samples to use later for biomonitoring. So in the urine samples, we found that women had multiple chemicals of health concerns in their body. Of the 28 chemicals that we tested for, the participants had an average of 20 in their bodies. Participants had anywhere between 12 and 24 chemicals that were detected in our study. And something interesting that we found was that some participants had lower concentrations of chemicals in their bodies than others. Individuals who reported using fewer personal care products had lower chemicals than those who had an above average product use. Thus, we were able to see that for our community, individual action can act as a solution for reducing chemical exposures. And so we went on to understand more thoroughly the products that participants were using. The 70 participants logged over 1,400 products. So these women were using a wide range of products, right? There were under 300 products that were being used by multiple participants, and the most reported products were personal care products, with Black women reporting more than Latinas. We also found that Latinas reported more cleaning products on average than Black women in this study. And the participants in the community in this phase of our work use an average of 11 products a day from various categories. And so once we got a better understanding of the type of products participants were using, we searched for some chemicals that we know are of health concern. Some of these chemicals have been associated with breast cancer, but we also wanted to look at other chemicals that were associated with adverse health outcomes like asthma. And so we targeted categories of chemicals like preservatives, including parabens, formaldehyde releasers, BHT, and BHA. We also searched for fragrances. We looked for not only when companies labeled an ingredient as fragrance or aroma or something like that, but also looked for specific synthetic or natural chemicals that we know would appear on the label as a means of fragrance. We also look for UV filters and ethanolamines, which are surfactants that are associated with organ system toxicity and other irritations. So we found that each participant was being exposed to at least one ingredient of health concern. So more than half of the participants logged at least one product with a formaldehyde releaser, and one participant even reported the use of a product with formaldehyde in it, and that was a eyelash glue, if I remember correctly. Nearly 80% of our participants logged a product with paraben listed on the label. And this is interesting to me because so many companies have been moving away from parabens now that people are becoming more aware of their potential harms. And so now I want to share with you products that we found listed parabens on the label. So hair and body, hand and body lotions more often labeled, or there were more products with parabens and on the label that were hands and body creams. Also, oftentimes the facial soaps, cleansers, and wipes have parabens on their label. So typically what you're going to see on the label are things like methyl, propyl, something, 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 paraben. And so, yeah, we found that many products did have the parabens on their label. We also found that many products listed formaldehyde releasers. So, similar to the parabens, those hands or body lotions and creams are gonna have formaldehyde releasers more often on the label. So, um those are going to be your hydratins, or something that your uras, things like that on the label. And we also found that there are some products that listed chemicals of concern more often than others. For the products reported by our participants, holding sprays, or heat protectants, perfumes, body sprays, some type of sprayed on fragrance, face creams or moisturizers with sunscreens, and hand and body lotions were the chemicals with the highest average number of hazards listed on them. And so now that we have a little bit of insight into some of the chemicals our participants are being exposed to, we will keep diving into that data and better understanding that. But we wanted to use that information to inform our next study, which we are seeking to. Our thoughts are that we can reduce the risk of breast cancer for women who were using chemically straightened hair products. And these women are and to help these women overcome their obstacles and get to the point of starting a transition over to non products that are less hazardous. And at this point in time, they are vulnerable to using the chemical hair straighteners, because it is a process to go from using chemical hair straighteners over to non-straighteners. And so we wanted to focus on the hair journey and not necessarily like just, telling women to like switch over. And so we're looking to work with women to help them transition. So our intervention will provide some education on safer products and social support, and hopefully lead to lower chemical body burdens and improve the mental health for these women who are making this transition. So the population that we are looking to have are women who have a history of chemically straightening for their hair, but have been not using those products for more than a year, and create a cohort of women who can work together in to work together in their hair journeys. And so our aim is to develop a community informed intervention for women maintaining a natural hairstyle while limiting exposure to other EDCs, because we know that when you switch from chemically hair straighten, that doesn't mean that you're automatically in the clear of not being exposed to toxic chemicals. You could be switching from one harmful type of chemical or type of product over to some other product that isn't a chemical hair straightener that may also have these EDCs in it. And so we wanted to collaborate with community partners to design and create educational material for recruitment and data collection. And we also want to measure changes in chemical exposures that were associated with switching from conventional beauty products to beauty products with limited EDCs, and assess the contribution of hair products to the total exposure from beauty products. And we aim to document women's experience, including motivations, barriers, and reactions to transitioning from chemically straightened hair to natural hairstyles. We will use a semi-structured interview and surveys, mixed methods to address this, and we want to measure stress, mental health, and other experiences to see how we can we can see the changes over the course of the study. Now, one thing that I'd like to mention is that in this work, we put a lot of emphasis on personal impact. And we are because we're telling women if they avoid certain chemicals, they can reduce their personal, if they avoid certain chemicals, they can reduce their exposures personally or within their household. But this is only one piece of the puzzle, and there are multiple layers and levels to impact that can be made when it comes to reducing chemical exposures. We also know that Black women buy 9 times more hair products than other groups of women. So buying power may lead to an impact upwards, which can influence retailers to stop selling or manufacturers to stop making products that are harmful. But also when consumers and institutions show concern, it could lead to regulations being put in place. But there is also the possibility for impact downward, where policies are put in place, which then lead to manufacturers being required to exclude certain chemicals from their formulas, and certain retailers from selling products that may lead to greater impact. So we don't want to come off like all of the responsibility should be on consumers, but because this is not true. If there were more regulations on chemicals, the responsibility would not be on the consumer. But we do see slow change happening, and I see a future where we take more precautionary steps towards protecting people instead of reactionary. But until then, there's the Detox Me app. So Silent Spring developed the Detox Me app to provide clean lifestyle guides that walk you through simple research-based tips on how to reduce exposures to toxic chemicals where you live, work, and play. There are approximately 300 research-backed tips about chemicals in your products, and ways to explore how to avoid them. There's also some DIY recipes to replace commercial products that contain endocrine disruptors and other toxics with simple non-toxic ingredients. I do want to note that the Detox Me app is not one of those resources where you're going to like scan a product and see like a better option, or see, get that rating of what that product, like, is it green or is it red? But more so, it's a resource to learn more about the chemicals in your environment. So as an example, I've used it when I was getting new pots and pans. So I was like, hey, what should I look out for when I'm going shopping for pots and pans? Hey, I want to buy a new, some type of cosmetic. What should I be searching for? So it is not an app where for that. It is not an app it is more of an app that is useful for creating understanding more about the chemicals in your lived environment. And with that, I'd like to thank you all. I really appreciate the NBCC for having me share my work. And if you want to connect with me, my email is here on the screen. If you want to learn more about the Taking Stock study, you can go to takingstockstudy.org.
Dr. Franklin, thank you so much for all of that information. That was really very interesting. And I would like to invite the folks who are listening in on today's webinar, if you have any questions for Dr. Franklin, you can go to the menu at the side of your webinar, and it should say questions. And you can click on that and drop down the menu and type in some questions there. And in the meantime, Dr. Franklin, could I ask you, what are some tips for reducing exposure to these chemicals? I mean, every product you mentioned is a product that I use, right? So if I wanted today to start to take some personal responsibility as a consumer, what are some of the things that I should be doing or thinking about?
I don't want people to be overwhelmed with this idea like everything around me has chemicals that are bad for me. And so I highly suggest that people take it one step at a time, one product at a time, one thing at a time. And my advice is those things that you use that you really don't care for, you just kind of use them out of habit rather than because they really have a true function in your life. I would start with those. So if you are someone who's putting on 3 layers of foundation, consider which layer you may not need. If you're putting on mascara, think about, okay, well, next time I go get my new mascara, what, you know, what should I be looking out for in that? And so I think like I recently moved. So it was really important to me. And this is outside of beauty care, right? I recently moved. So one of the things I was really intentional about was when I purchased my pots and pans that I did not choose the non-stick options and that I stuck with stainless steel and cast iron. And yeah, so when it comes to my advice, I think like it's just taking it one step at a time. I know there are some things that I'm just not willing to let go. Like we know that there are some toxics that are released from plastics and different products like that. But you have to be realistic and like we all want to live and live our truth and our happiness. So there are some products that if you really love your red lipstick, like don't let go of the red lipstick. Instead, get rid of the I don't know your whatever powders you're using. So I think like instead of using a powder and a cream, maybe just choosing one or the other. And yeah, that's my thoughts about that.
So one of our listeners has posted a question and they want to know, where can a person get tested for body contaminants? Can these be done with a blood study?
That's a great question. It's actually outside of my scope of understanding. I know that we at Silent Spring used to have our Detox Me Action Kit that um, where participants could share with us urine samples and we would be able to report back to them more information about like what we found in their urine and but we haven't done that for a few years. I am curious if anyone in the audience knows exactly where you can go to test for some of those chemicals in the body. But I'm not quite sure where you can go today to test for your like just on a everyday l- life experience. But if you email me, I will find out for you, whoever you are. So yeah, just if I can share my email later. But yes, I'm sure there are ways of being tested for those chemicals if you aren't someone who is a part of a study, somebody's study design.
And certainly somebody can go to their medical care provider and indicate their concern about their level of exposure. And it sounds to me like for your study, it was really urinalysis that was being used. And that would mean, like, I'm just trying to think back to my own training and days of, would that mean that it's actually at a higher concentration because it's now getting filtered out of the system than what might be found directly by a blood analysis?
So are you saying like the difference between what's being filtered out versus what is still remaining in the body?
Yes.
Yeah, I'd say a lot of the chemicals that we tested for have short half-life, so that means they aren't necessarily staying in the body for a long time. They're being constantly filtered out. But what our study speaks to is that even though they have short half-lives and they're constantly being excreted, that means that the participants are still exposing themselves to
Over and
those
over.
chemicals on and on and on, so that when we are testing them, they may have used some product or had been exposed to that chemical in the time, in the frame in which we could catch it. And so I remember I went to a talk the other day, and he spoke about like the chemical, like when he was doing the biomonitoring with the wristbands, that the variation from person to person, like the variation from person to person, is much more distinct than the variation from a person on a different time stamp. So people have their habits, and you stick beside them. And so like the chances that you'll catch it, even though their half lives are short, is high, because you typically have your day to day, and you're potentially exposed to the same chemicals regularly.
Is there a clearinghouse or a list of chemicals that we should be trying to avoid that are specifically associated with breast cancer?
Um, whether there is a list now, I know that we're currently seeking to get a nice um all-encompassing list of not only endocrine disrupting chemicals, but other like mammary carcinogens, and things like that. Whether that there's a comprehensive list available now is, I'm not quite certain, but um, I'm sure there should be a list of EDCs that are available that have been associated with breast cancer.
And with that, like the results of the study are very interesting, not just to, I think they're interesting for everybody to hear about, but certainly targeted towards women of color and minority women. How are you sharing these results with the community so that they'll have the greatest impact?
Yes, we are sharing the results of this study in particular back with the participants of the study, through our digital report back that is designed by Silent Spring. So we are sharing back with the participants about what chemicals we found in their urine, what ingredients we found that we thought were of concern that they should know about. So we're also sharing, so we're sharing those back with the participants alongside with tips and things that they should understand about why we're even telling them to look out for these chemicals. So an example is we do highlight that they may want to look out for fragrance on their product list, because fragrance is just an umbrella term, quite frankly. And there are some companies that are outsourcing their fragrance for their products, so they don't even know sometimes that those that ingredient can be multiple chemicals of health concern that they're then incorporating into the formula. So what we let participants know is that chemicals like phthalates may be in the product, just by the product containing fragrance, because it's like one of those just ambiguous terms, and we are moving towards and seeing that people are looking to regulate the term fragrance and making it so that there's more transparency in that term. But where we are what we are sharing now is we've seen multiple times on the ingredients list of our participants that it just says fragrance, and no other information about it. And so, yes, with the participants, we're sharing back the information that they gave us, but also this information is helping to inform our, multiple interventions that are that we're doing. So for the Taking Stock 2.0, a lot of what we learned, something that really stood out to us this time was how many products have formaldehyde releasers in them. So we are making sure that when we do our intervention for the Taking Stock 2.0, that we are highlighting, hey, you need to look out for these certain chemicals. And this also helps to inform other work that we're doing at Silent Spring. So I know last year I shared about the product option and women engaged research project, where we're sharing information about toxic chemicals in consumer products with Black women online in collaboration with influencers. So influencers are creating content to share with their audience. And so these are all informations that will help us with informing influencers. What should you be sharing with your audiences? What are things that aren't often talked about? So those are a few ways, and there are many more that I probably just can't think of off the top of my head. Ways that we're sharing this. Also, we put our study outcomes on the Silent Spring website as well. So there's always information there about our findings.
And one of our participants today said that the environmental working group has lists and also ranks their level of toxicity. So that might be a resource for folks to go to if they're looking to reduce their exposure to chemicals found in women's products. Are there chemicals that were in products that were not listed on the label? Because you mentioned fragrances, like this catch-all phrase. Are there other, like I'm thinking, is there other stuff in there that they're not exactly explicitly, listing as part of the ingredients?
It is important that we highlight that this study in particular, we did do testing of around 30 products, but women reported over 1,400 products. So there are about 1,460 products that women reported using. And so what that means is that, like, product testing is a very expensive, to be honest, expensive task, and we would love to have tested all of the products. What Silent Spring has done in the past, and others as well, have tested products to see how accurate their labels are. And I like to just acknowledge that there have been studies, ours included, that show that those ingredients lists are not accurate. They are insight and a glimpse into what is in your products. However, there are certain things that may contribute to there being some other chemicals in your products. We talked about fragrance, but there are also contaminants that just get into the sourced chemicals, right? So there are chemicals that are found in when sourcing certain chemicals. We know about the talc powder issue, and how asbestos has been harvested with the talc and things like that. And so it can lead to adverse effects. But so that said, the label itself is a great insight into the products, but you want to be sure that you do get that I want to be sure you understand that there are also other chemicals that may be present, but because we don't have the capacity to test every single product, that is not something that we could report.
And what about price point? Because I see this also come up as an issue for particularly folks who may live in communities where resources are limited. And so they may be buying, products from, a local big box store versus, an online beauty retailer. Is there a difference in the ingredients that we see based on price point? Is expensive better? I mean, a lot of women spend a lot of money. This is a big industry, But is expensive actually better than some products that you can get locally?
I don't know of any evidence that supports that expensive is better. I will say that in my personal experience, that more expensive may mean that there are more active ingredients, and not all active ingredients are safe per se. So for instance, if you're buying this expensive skin light, like, oh, what, skin lightener, but it's people, and I've seen companies stepping away from skin lighteners, and they're using like this beautiful term, skin brightening formula. Right? So we're using these terms that essentially go back to skin lightening, like, you it's a skin lightener. And so there are just some active ingredients that aren't necessarily the best for the body. Again, I don't know that there is any evidence that more expensive is better. Uh, but and that might be a key thing for us to look out for. I do know that, like, there we have seen that when a product is labeled as clean, you know, there's an upcharge, and so that creates accessibility issue in like certain populations where um if you want to use a product that's clean, however, the cheaper lotion, this is the difference between buying a $3 lotion and a $15 bottle of lotion. And so I may not be able to use the clean version right now. And yeah, there's that. So no, I don't know of any evidence about expensive being better. I just like, yeah.
Well, I love Dr. Franklin. We are breaking down those myths right here, right? Because how often do we purchase a product and actually truly investigate the ingredients that are posted, and then investigate whether or not there are hidden ingredients, based on what is not actually being specifically listed. Doing that kind of research, and it may create some product loyalty, but most women buy what they think is going to work for them. So I think it's a great myth that we are debunking right now, that just because you may be spending more on a product, it doesn't necessarily mean it has any other better health benefits than a product that might have more natural or fewer ingredients. So I think that's great.
Yeah.
That
And
that
not
right
all
here on MBCC webinar, we're knocking that myth down here.
and also not all natural chemicals or ingredients are thought to be the best, have the best health outcome, like to be associated with the best health outcomes either. So there are natural chemicals that have been associated with adverse health outcomes. And uh, I think like Dr. Tamara James Ty has spoke to this with regards to essential oils and things like that. And so yeah, not all natural things are associated with better or healthier, just to put that out there. And everything is a chemical. Everything around us is a chemical. Water is a chemical. So again, we don't want to tell people avoid chemicals because you're made of them, but you do want to be aware of those that are um, toxic, and at least have the knowledge to make an informed decision.
And you had mentioned that a lot of the chemicals that you were talking about had a short lifespan, and they were going to, are they, so this is speaking to the biodegradable issue. Because one of our listeners said, hey, wait a minute, all body excretions end in sewage waste. But if these are going to break down and they're biodegradable, it could be that they're not necessarily getting into the environment, but their antecedents could be, and they could be just as bad.
Yeah. Yep. That's a great point.
Well, this has been very enlightening, Dr. Franklin. I want to thank you so much on behalf of myself and MBCC's Board of Directors and Cheryl Osimo, MBCC's Executive Director. I want to thank Dr. Franklin for this very informative discussion today. And I want to thank all of our many listeners for joining us. For those interested, the recording of this webinar will be made available later today on the MBCC website at mbcc.org. Have a great afternoon, everyone, and thank you again, Dr. Franklin.
Thank you for having me. I really appreciate it.